All right, today we are diving into something truly incredible, a discovery that could seriously change how we think about cancer care. We're talking about a powerful new ally, and it's found in a place you'd probably never expect, your own gut.
So let's just get right to the headline because it is an absolute stunner. We're talking about the potential to literally double the overall survival rate for some cancer patients who are on immunotherapy. This comes from a huge meta-analysis. That's where scientists combine a whole bunch of studies to get one superpowered result. And it showed that this isn't some small adjustment. No, this is a massive leap.
So you have to ask the question, right? How on earth can something as simple as the bacteria living inside of us have such a huge, life-changing effect on a cutting-edge treatment like immunotherapy? Well, that is exactly what we are going to unpack. To really get why this is such a game changer, first, we need to understand the problem. Let's call it the immunotherapy challenge. And it's all about why this amazing treatment sometimes needs a little bit of a helping hand. Okay, so a huge part of modern cancer treatment are these drugs called immune checkpoint inhibitors, or ICIs for short. The easiest way to think about them is that they basically take the brakes off your own immune system. They allow your body's T cells to finally see and go after cancer cells. And they can work wonders. But here's the catch. They don't work for everybody. And for years, the big question has been, why? And it turns out the answer seems to be a tale of two guts. It's fascinating. Researchers started noticing a pattern. The patients who responded really well to these drugs, the high responders, they all tended to have a really diverse and healthy community of bacteria in their gut. And on the flip side, the low responders, their gut microbiomes were way less diverse, maybe even damaged by things like heavy antibiotic use. The difference was right there, inside them. And this, of course, led to the big breakthrough in the gut. Scientists realized this wasn't just a coincidence. The microbiome was actively playing a role in, well, supercharging our body's own immune system. This is where things got really interesting. A huge study in the journal Cell pointed the finger at one specific bacterium, Lactobacillus reuteri. They called it a sensitizer. What that means, in simple terms, is that this one little microbe could make tumors that were totally ignoring immunotherapy suddenly wake up and become vulnerable. It was like finding a key to a locked door. So how does it actually work? How does a tiny bacterium boost this multi-million-dollar treatment? Well, it all comes down to some really simple but powerful chemistry that's happening inside you right now. Just think of it like a little production line. Okay, step one, you eat food that has an amino acid called tryptophan. Then step two, the good guys in your gut, like our new friend L. reuteri, get to work. They grab that tryptophan and they convert it into something else, a really powerful compound called I3A. And then step four, this I3A molecule travels from your gut all the way to the tumor and basically gives your T cells a pep talk. It supercharges them to get in there and fight. It's just a beautiful system when you think about it. So this molecule, I3A, it's the real MVP here. It's a metabolite, which is just a fancy word for a byproduct of the bacteria's digestion, and it works as an immune system activator. It's the signal. And the proof is in the pudding. The research is clear. Melanoma patients who respond really well to immunotherapy, they have way higher levels of I3A floating around in their blood. The evidence is right there. So this discovery has led scientists to basically create a kind of dream team of what we can call Probiotic Allstars. These are the specific bacteria that the research shows are making a real, measurable difference for patients. And the evidence is just, wow, it's really compelling. For lung cancer, a Japanese probiotic with Clostridium butyricum was linked to a 2.5 times higher progression-free survival. We already know about L. reuteri and its I3A magic for melanoma. For GI cancers, having a lot of Lactobacillus gaseres seems to predict a better response. And get this is wild. In one trial, they took patients who weren't responding, gave them a microbiome transplant from someone who was responding, and it boosted the success rate from 20% to almost 40%. Just incredible. Let's just zoom out again for a second, because these numbers are staggering. That big meta-analysis found that using the right probiotics nearly doubled overall survival and almost tripled the objective response rate. The objective response rate, by the way, is the percentage of patients whose tumors actually shrink in a big way. I mean, numbers like these are the kind of thing that make researchers' heads turn.
So what does all this clinical jargon actually mean for a real person, for a patient? It's actually very simple. Better progression-free survival, PFS, just means more time where the cancer is not getting worse. And better overall survival, OS, well, that means a longer life. At the end of the day, that is the ultimate goal of any of these treatments.
So, all of this leads us to a really empowering idea. If these bacteria are our allies in this fight, then how can we support them? It's time to talk about fueling the fight and the simple dietary choices that can help your microbiome do its job.
Hey, remember that production line we talked about, the one that starts with tryptophan? Well, the great news is you can get it from a ton of really common foods. We're talking turkey, chicken breast, salmon, eggs, but also great plant-based foods like edamame, tofu, tempeh, and even pumpkin seeds. And here's just a really simple, actionable tip you can take away from all this. If you pair a food that's rich in tryptophan, like a handful of pumpkin seeds, with a food that has the right bacteria, like a yogurt that's full of lactobacillus, you are literally creating that production line for I3A right there in your gut. It's that direct. How cool is that? So all of this research really leaves us with a pretty profound question to think about. Is it possible that the future of cancer care is found not just in a high-tech pharmacy, but also in our own refrigerators and in the amazing living world inside our gut? It definitely points to a fascinating new frontier.